Good morning. Welcome to the Tuesday, December 15th, 2020 meeting of the Reno County Commission. Our first order of business this morning is the Pledge of Allegiance to the American flag. Would you join me, please?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Commissioner Hurst, I believe we have Pastor Kim Berry on the phone for our prayer this morning, please.
Kim, are you there?
Yes, good morning. Will you pray with me? Emmanuel, God with us. Thank you, Lord, for the Christmas miracle of hope, bringing light to the darkness. The prophet Isaiah spoke of the coming of a great light, the light of the Savior, the birth of God with us. It is directly into darkness that Christ child enters, representing God's love for all of humankind. God of peace, be with our leaders and direct this meeting today as they unify for the good of this county. May they be instruments of light bringing hope. Guide them to make wise decisions that sustain peace on earth and goodwill to all. We pray all of this in the name of the Christ child Jesus. Amen.
Thank you, Kim, very much for being
Thank
on
you, Kim.
Take care.
the phone. At this time, we have our district attorney with us, Tom Stanton. Tom, you have a new staff member to introduce to the commission, please.
I do, and thank you. As I did with all of my assistants, I would like them to know you and for you to know them. This is Sierra Logan. She's our newest assistant. She'll be handling our pretrial docket and our misdemeanors, traffic cases, and also helping with some felony cases. She was a prosecutor in the city down in Wichita, and now has come to Reno County, and I'm very pleased to have her.
Sierra, would you mind, we had all the other people in the district attorney's office tell us a little bit about themselves, where they went to law school and their background. Would you mind doing that, please?
Absolutely. I was raised in Wichita, so I'm from the area. I went to Wichita State for undergraduate and master's degree, and then I went to Washburn for my law degree. Graduated in 2019, and then started at the city of Wichita after I passed the bar.
And what was your master's degree in?
Criminal justice.
Oh my, so you were thinking that way for a long time.
Absolutely.
Okay. Well, very good. Very happy to have you with the county.
Very happy to be here. Thank you.
Okay. Tom, thank you for bringing her down.
Appreciate it.
Yeah.
Glad to meet you.
Okay, I have no announcements today. At this point in time, we have an update from the Hutchinson Regional Medical Center from Ken Johnson, their president and CEO, and Chuck Welch, vice president, chief business development officer. Gentlemen, welcome.
Good morning. Thank you for having us. Appreciate it. I was asked to just provide a little bit of a hospital update, and I will do that as of the 7 a.m. census this morning. We had 77 patients overall. 20 of those have tested positive for COVID. We currently have 4 folks on vents and 11 others that are on some other type of breathing device. So, it's a one-day trend, if you will, but our census, COVID census, has been in the mid to upper 30s and even in high 40s over most of November. So today, as of 11 o'clock last night and 7 o'clock this morning, I'm at least pleased to say that we have a few less COVID patients. We have, as I mentioned last time I was here, we have been postponing the best we can, working with our medical staff, elective cases, elective procedures, and surgeries. The hope is that as we have beds available and staff to take care of our community, we're able to do evaluate and do more procedures as we go forth. The challenging well, at least one of the challenging nuances to this is we still have about 48 employees that are out ill. It's been as high as 61. It's been as low as in the 20s several months ago. We had 90 test positive in November and 45 in December. So as we are able to get those folks back and augment them with temporary help or locums help as well, again, we hope to be able to resume some of our elected procedures and take care of our community that needs care. The other thing that I thought we'd give you a quick update, and I'll invite Chuck to brief you on. We're all interested in the vaccine, and when the vaccine arrives, and there's still a lot of information that's forthcoming. We have our team and our medical community members have been working together since, well, actually for the last couple of weeks, but certainly since last week to create the logistics necessary to efficiently and effectively distribute the vaccine. I have talked to many of my medical staff members and clinical staff members and other colleagues, and have not found anyone that hasn't been interested in taking the vaccine as soon as it's available. So I might invite Chuck to give you a few more details about what we know as of 5:30 this morning on the vaccine.
Good morning, Commissioners. Chuck Welch, Vice President with Hutchinson Regional Health System. So as Ken mentioned, there's been a lot of questions, a lot of interest in the vaccine. How many are we going to get? When is it going to get here? Who's going to get it first? And right now we don't honestly have a ton of information. What we know is that there is vaccine en route. We're going to get an initial batch of 24,000 doses for the state. This is a 2-phase dose, so you'll get your first shot 21 days roughly with a 7-day grace period. You'll get your follow-up shot. So this first batch will be the first round dose meant to vaccinate 24,000 people the first time. Evidently, after that, we're going to get another roughly 175,000 doses by the end of December for the state. The directive that we've read is that healthcare, frontline healthcare workers, those that are in exposure all the time, should be vaccinated first. We have worked closely with our clinic partners throughout the city to find out which of the employees have already had COVID. They may have some residual immunity left. Who's at higher risk, and we're trying to stratify and cohort those groups so that when we get vaccine in and bring a batch up to room temperature for administration, that we can utilize that effectively and not waste any. That's really the goal. So that's really where we're at right now, is coordination, cohorting, risk stratifying the groups so that we can implement and distribute that vaccine in the most effective way.
And you're not sure when that'll be received in Hutchinson?
We don't have any direct dates. Right now, the hospital is looking at being the hub for storing that, not the administration point. We'll leave that to the clinics, but we don't have a definitive date.
Since Wichita got theirs yesterday, it seems like we should be getting ours soon.
We sure hope so. We certainly don't want to overpromise and underdeliver, but yeah, we're hoping sooner than later.
Would one of you talk a little bit about if you can? I heard something from maybe it was a radio interview or something of that nature, where you were suggesting that the patients that you were getting on average that were COVID positive had the virus much more strongly than early on in this cycle.
So
is there a reason, or is that just the people infected, or is there an explanation for why our latest groups might be harder affected?
So that came from a conversation with our pulmonologists. We have every Monday morning, we have a clinically focused COVID task force meeting with everybody in the community who's a frontline care provider, so all the physicians from all the clinics. And the observation came that since September, the group of people that we're seeing are sicker, more acute, and their path with this virus through the hospital is much more severe. So before, early on in March, we would bridge them on a ventilator, put a tube in their throat, put them on a mechanical ventilator, a breathing machine, bridge them until they could recover, and then we would take the breathing machine off and they would do pretty well. Now what we're seeing when they go on the ventilator, they're a lot sicker, and a lot of them don't come off of the ventilator, unfortunately. So it's anecdotal. It was a comment, observation made by all of our pulmonology team.
I think I remember it was a pulmonologist that said that. Mhm.
Yeah. Why that is, we don't know. There's a lot of speculation about the morphing of the virus and all that things.
And the anecdotal part was the most important part there, because they saw very early on in New York City, when you're artificially ventilating folks, they died. They had an 80 to 90% mortality rate. So, yeah, that's very anecdotal. I've not read any evidence that that's the case across the country. So I think that's somebody's observation, but they're getting to you sicker is what's amounting to.
Yeah.
Okay. Other items you want to bring up to us today, Chuck?
None for me.
Any other questions? I appreciated the facts we got the other day from the hospital, Regional Medical Center, with regard to a comparison between 2015, 16, 17, 18, 19, and 20 deaths. And through October, it was interesting that it was actually even between 2019 and 20. But we did see some spikes in both October and November. But up until October, there's not much difference between them. So it was interesting to me, that data, and I appreciate you getting that to Randy so he could pass it on.
You bet. We're continuing to mine that. There's been a request to just look at the Reno County residents, and so I'm continuing to filter through that just to try to give you as much information as we can.
Okay, thank you very much for being here.
You bet. Thank you.
Okay, at this point in time, we'll ask Adam Warshard to come and speak to us as Emergency Management Director. Adam, your turn at the podium, please.
Hey, good morning, Commissioners. Adam Weiss, our Emergency Management Director. I'll just have a few things for you this morning. I'll give my typical full update for you, but the Board of County Commissioners declared a public health emergency all the way back on March 19th, and that was extended until December 31st of this year. What I want to talk to you about is extending that declaration and have a discussion on that, what that could look like. The State Finance Council last week extended the state declaration until January 10th of 2021. My recommendation to the Commission would be to extend our declaration until January 19th. That would be the third Tuesday in January. And why I picked that date was simply to have Commissioner-elect Friesen in here before we extend it for a long period of time, or we should have an idea after the first year what it looks like both from a local level and a state level. What the disaster declaration really does for us is it allows us to access help from the state and federal government. Anything that we do locally and we support locally, we have to have a disaster declaration in place before we can request supplies or equipment from the state or federal government. In the past few weeks, things that we've received from the state or the federal government are PPE, testing equipment, and ventilators for the hospital. So just those three basic things, being able to request those from the state is huge for us, and that's really why I would like to see that a disaster declaration stay in place. So I wanted to just have a discussion with you today to kind of figure out where the Commission would like to be on that disaster declaration. so I can work with Mr. O'Sullivan here in the next week or two and prepare that document to be signed so we can be sure that there's no lapse in our local disaster declaration. Do you have any questions on that before I move on?
No, go.
Can you flesh out a little bit more what exactly it does versus when it's not in effect?
So if a disaster declaration is not in effect, we have to rely 100% on what we have locally. We
And
cannot.
what does that mean?
So it's what we have currently inside the county. Our PPE we have here, our supplies we have here.
You
et
can't get it
cetera.
anywhere else.
If we can buy it ourselves, we can order it ourselves, we can do that. But if we have a disaster declaration in place, we can tap into state and federal resources. And also if we have extra expenditures that aren't covered by our CARES money or other grant money, we can keep track of those expenditures, and qualified expenditures can be reimbursed by the federal government at 75%, and the state will usually add an additional 10% on that, bringing our total reimbursement to 85%.
What kind of strings are attached?
I don't understand that question.
We rarely get something for nothing, so
I guess the only strings that are attached are the commission, our elected officials, have to agree to put us into what we would call disaster mode. Our emergency operation plan would be active, and specifically our response and recovery portions of that plan. So it's saying, hey, we have a problem in Reno County. We're addressing those issues the best we can with the resources we have, and we're tapping into state and federal resources to do that.
you know, I have not seen that declaration to my knowledge, and maybe you did send it to me. And I'd like to see, I'd like to see the paperwork associated with it all.
Absolutely, and that's something we can send to the commission, and we can send you the current one, and then if we decide on a date or some sort of extension, we can send you a draft document as well, so you can have that in front of you before it goes into a live meeting and it's discussed further.
Okay, thank you, Adam.
Is there, can we, if we would put a longer date on the emergency declaration, could we then come back in, if we don't need it at a later date, and decrease and say, okay, say we made it for 3 months or 4 months, then we could come back in, we don't need it in a month, we could undo that declaration. Is that correct?
Absolutely. So there's, depending on which counties you look for, there's some counties that do it for months at a time, there's some that do it for a week at a time, and there's yet other counties that put a declaration in place until it's rescinded by the Board of County Commissioners.
That was my question, if that would save everybody some effort that way.
Okay, why don't, my suggestion here would be to send that information to all of us, Adam. We'll discuss it next week and try to have that on the agenda of the last meeting of the month,
Sounds great.
which is, what, 3 days before the 31st?
22nd, 29th?
29th, I think, yeah. Okay, thank you, Adam.
I would think if some counties are doing it month by month, there must be a reason. I presume a guy will be able to glean that from the paperwork you send.
I don't believe there's a reason. My personal opinion is there's absolutely no fault in having that piece of paper in place, that active disaster declaration in place. But if we don't have it in place, that's where it could cause some trouble for us. I just think it's up to each elected board how they feel. If they want their emergency manager up in front of them every week to discuss what's going on, they want to extend it week by week, or they say, yeah, we know this is an issue, and they do it until it's rescinded.
Okay, thank you, Adam.
Thank you, Commissioners.
Karen, our interim health officer. Good morning, Karen.
Good morning. I get some paperwork printed off.
Thank you.
Thank you, Karen.
As of today, we have total cases of 5,948. We have total active cases of 729. Total community active cases is 703. That is without the inmate population. We have a 14-day positive test rate. That was from the 6th. That is at 49.2%. Last week it was at 48.3%, so that did climb. We have a 14-day new case count of 1,106. Last week that was at 1,136, so that did decline. We have had total deaths. We've had 80, with deaths in the last 30 days have been 47. We've had total hospitalizations during the pandemic of 263, with 86 ICU admissions and total intubated, and those are Reno County residents of 28. I think Chuck and Ken gave you an update that we do have the immunizations are coming. Pfizer was approved on Saturday for the emergency use in the United States. We are working as a collaborative with the hospital, the clinic, Prairie Star, Summit, all the entities that are on the front lines. They're working with patients and working with a plan to formulate that. We're following the KDHE CDC guidelines. There's a vaccination plan, and we're following that as to get to those frontline employees as it comes out. The most common side effects are fever, myalgia, which is just pain in your muscles or group of muscles, so like the back pain that they complain of, headache. I did want to go over just some of the strategic planning that we have done through the pandemic, because I'm not sure that everybody knows that all of the things that we have been doing with collaboratives from the Reno County Health Department, including the hospital collaboration, which has been Hutchinson Regional Medical Center, Hutch Clinic, the Reno County Health Department, Hutchinson Correctional Facility, Hospice, Prairie Star. We speak every Monday morning at 7 a.m., going over all the treatments that they're doing in the hospital, what's looking like in other parts of the world. It's very important to have Hutchinson Correctional Facility on there, as they've had a huge outbreak, and their physician has been on there talking about reinfections. They talk about treatments, logistics of separating the patients, PPE, pharmacy staffing, community awareness. It's a huge collaborative. There's also a medical collaborative that they just meet with providers. They discuss the medical related issues going on. There's a Reno County Economic Task Force. It is RCERT. It's community members, business, medical ministers, long-term care facilities, the Reno County Health Department, just to name a few. They have worked to open up Reno County and address economic recovery and community issues. The superintendents have been meeting. There are 6 school districts, 2 private schools. The Reno County Health Department and the Hutchinson Clinic have worked as a collaborative to open up schools, to communicate with them, educate them as to what's going on. We meet weekly. Long-term care facilities, administrators, Reno County Health Department, Hutchinson Regional Medical Center, they have all been working on issues related to the dynamics of long-term care facilities and keeping our older population at risk taken care of. The Reno County Ministers Group, they also meet weekly. I do not meet with them every week, but they certainly welcome us every time. They welcome Nick and then myself as well. We just wanted to point out the graph as well. This is a graph of what Hutchinson Regional Medical Center was able to put together. This goes over the statistics of mortality at the hospital for the last 5 years. And if you can see, it kind of goes up and down throughout the years, which you would suspect as things go through. But if you look at 2020, when it hit to September, when we noticed a spike, we have had an increase of cases since then. 2015, we actually had the same amount. But you get into October, it's nearly twice the amount. November is 3 times the amount. We haven't had December's totals yet, but is also elevated. So that was something that we wanted to punch out. When we did see this surge, that this is what we have seen with the mortality rate at the hospital, it truly is an increase of patients, not just people that have comorbidities. It's actually taking people with comorbidities out much earlier than they would have been. For this reason, we were going to talk about the health order again today. It was put on the agenda to review 1 month after we put it into place. And therefore, for these reasons, we would like to continue. The collaboratives that we've been working on are pushing forward to continue having the health order in place as is. And we can look at that again another month as we extend that.
Now, you said something about this was taking people out on this graph, and I didn't follow. You said something about comorbidities and then taking people out, and I didn't understand what you were trying to
I
convey.
probably misspoke, but that would be that, they are dying in the hospital at a faster rate. So there's always people that are going to die. We know that. That's the one truth. But sometimes it's something else is going to be that catalyst, and it's been that catalyst at a huge rate. So
I'm not understanding what you're saying there. If something else is going to be a catalyst, you mean the virus?
the virus is a catalyst. So if you have some comorbidities, it's actually taking more people at a higher rate than we normally would have had if we didn't have the virus going on.
Right, and we've known for an extended period of time that this virus affects older people with coexisting diseases, so we're very, very aware of that and have been for an extended period of time. Correct?
Yes, and that is why we're trying to do all the mitigating things that we can, that we have the health order, because this is a large number of people.
Okay, across the state with a median age of 80 to 81 years old. And again, what we see, Kelly this week finally came out and drew some focus to the nursing homes for the first time, though they kind of left them off on their own for a while. And they constitute what, 33% of our clusters? An incredible amount of the deaths. And so, as we've known for months that it preferentially preys on the elderly, we've really, unfortunately, done a very, very poor job of providing any focused protection to those groups. And till now, it's so obvious that finally the governor has pointed at trying to move some more efforts that direction. So, yeah, again, that gets into that focused protection that we've been talking about for an extended period of time.
I do believe that we've done a lot of focused protection on the nursing homes. Unfortunately, the virus does what it does once it gets in there.
It does. That's a fact. It's tough. It's tough. I wonder in that graph, and talking about the mortality rates, the real worth of looking at mortality rates in a hospital is to figure out how you can cut your mortality rates. That's where the real worth is, and that's not what we're really using it for here. But I know Hutchinson Regional Medical Center does serve as a referral center to some degree. So really, if you truly wanted to look at deaths, you'd have to look at Reno County resident deaths and see how that was affected. But the real worth of this is for our hospital to be able to go back, compare this to other hospitals, and see what they can do to learn how to provide better care and cut the mortality rate down. That's where its great use is. After the fact, we're not going to accomplish a whole lot. It's kind of after the fact. But so standalone, it doesn't tell us much. I have an incredible number of constituents who don't agree with you on the health order, and I've been hearing from them extensively. I don't know how you make the case that your health order moved the needle over the last month.
So we're following all the KDHE and CDC guidelines, and with the collaboration that we're working with
so
the
you're
hospital.
Just talking with people. You
I'm
don't have any
talking
data. You can't support that your health order moved the needle with data.
So we are following all the guidelines, and that is what we are trying to put out there, to let people know
That
to do
health
that.
order is not a CDC or a state mandate. That's your interpretation of what you think's in our best interest and voted on by the commission. I'll grant you that. But what we've seen, and you can look at it on the internet plain as day, you can look at the case curves at all every state in the nation, and they all are, for the most part, are following the same increase and now plateau and decrease. You know, we're right on time with Oklahoma, who doesn't have health orders. Texas is still up a little bit higher on the plateau than we are. They don't have health orders. Nebraska has come down off the peak of their curve, way ahead of, not way ahead of us, a week to 10 days of us, as has South Dakota, North Dakota, Wyoming, of which none of those have a health order mandate. So the reality is there's no evidence that this health order moved the needle. And in reality, when you read the health order, it really doesn't do anything. You know, there's a dozen whereases, and what it really comes down to is you say the only punch to it is 10 people if you can't separate. Well, that's, Commissioner Sellers brought us the Sedgwick County mandate the other day, and that's way more constrictive than Sedgwick County. And so, the bottom line is, I've got a whole lot of constituents who don't like health orders. You have no data that supports that it's moved the needle on improving the situation. You're working with all these people. You have a $1.5 million fear campaign going on through the state that's got people, thinking continuously about this. We don't need a health order, because it hasn't moved the needle. It hasn't changed anything in comparison to surrounding states, surrounding areas. Y'all are using other means to accomplish it. It literally says basically nothing. And it is more constrictive than Sedgwick County and basically most every other county. And you've got no data that it's moved the needle, that it's improved anything. So why have an order that hasn't accomplished anything and literally doesn't say anything? That's not good governance on our part. It's bad governance. And the people have been overwhelming me with that concept that we don't need it. And I'm in agreement. I see no scientific reason to keep this thing going.
Dr. Steven, I do take one exception to the fact that you mentioned that the retirement homes haven't done everything they can. They have, as far as I know.
I did not say they haven't done everything they can. So they've done everything within their financial wherewithal. The state's left them on their own. The state's not come in and assisted them in much of any way. They finally came up with some CARES Act money for them. But no, I didn't say that anyway.
They have done a lot of work. They're keeping hard as they can.
They've worked as hard as they possibly can with the knowledge base and the weapons they've got, which is a test that isn't very accurate. It's not very timely, and they've done the very best they can. And people die. There's no question about it. But you accused me of misquoting you the other day.
I may have quoted you then, but the fact was the inference was that they've been left.
It's not. They've worked as hard as they possibly can, and I know they are passionate about taking care of those people beyond belief. I've talked with them for hours, so I don't think that. I appreciate that.
I took it that way.
I appreciate that, but it has nothing to do with the health order.
I have one question. Recently, not recently, but for a few months now, I have heard questions regarding these tests and how they're performed when they get to the testing agency. I recently, and I've seen this before and read this before, but Dr. Fauci has said that the cycles that they go through should basically be 35 and no more because of the exponentially higher the more times they run, that they can be a false positive. So how many times are our tests run?
We don't have that specific answer. That's going to be lab per lab, and different facilities are using different labs. So we leave that up to the experts in their field, and that is people that are running those lab tests.
Shouldn't you know that so that you can follow the rules that the majority of the experts say? Because if they run them 40 or 42 or 45 times, then you're getting a lot more positives out of that are not. I'm just curious. Why shouldn't you know that information and request that they're only run so much so you know you have an accurate test? I'm just asking that question.
So that would be something that we can certainly look into. The labs are varied. So you have Quest, LabCorp. We're using a different lab. We use KDHE as well. So you have several different labs that you would use. And so then are you saying that we should only use one lab?
I'm saying that you should put a requirement to those labs that they only run it 35 times. If that's what the experts say, which I've read this, and in more than one instance, I have read about this. So that's what I would request that. Maybe somebody knows a lot more about it than what I've just become knowledge of.
Why doesn't Karen talk to the group that she works with and try to verify that the 35 is correct? And
Well, it is known that the state runs cycles at 42 times. And it is known by scientific study that over 35 times, you cannot grow virus out of those people who test positive. And so, yeah, we know for a fact that we have a huge false positive rate, and that had become such a big problem as we've dealt with this whole thing, but particularly when the hospitals got a little busier, and then all of a sudden, poof, you're getting false positives in 20% or whatever the number, we don't know, of the people that work there, and all of a sudden they're gone for 2 weeks. And we also don't, then we're also confused with this concept of the asymptomatic spreader that they now call the pre-symptomatic spreader. No, those are false positives. Those are people who have early symptoms who don't tell anybody. The testing has been brutal, and the media and the Kelly administration has made it out to be a perfect little test. The PCR test was never designed to be used in this situation, but it was the best we had. And yet we just keep continuing. We've come up with a vaccine. We've come up with all sorts of inpatient therapeutics, but we've not refined the test at all. And it continues to be a problem. It continues to add to the problem. And the more people just buy in to the fact that, the test is positive, they've got it, that's garbage. And that's why you're going to end up being told that if you've had the virus, that you need the vaccination. Well, they have to do that because they've got so many false positive people running around thinking they had the virus and they didn't, that they're going to have to be vaccinated. What I was going to say later on, what you can do if you want to really know, do a good deed, go donate blood. If you go donate blood, if you've tested positive and you had no symptoms, go donate blood, because they're going to test you for antibodies. And if you test negative for antibodies, you never had it. You're a false positive. 99.99% proof. But if you do a good deed, go donate some blood if you were tested positive and had no symptoms. And that's the test they would have to do. They'd have to take all those people who tested positive, never had symptoms, do antibody tests on them, and you could work your way back to whether they actually had it or not. And the whole point, and not just hear me ramble, but the point is there's so many gaps in this, and it all comes straight back to a health order that doesn't say anything, doesn't do anything, doesn't have any data that it moved the needle. It's an imposition on the free will and freedom of individual rights, and we just don't need it. It's not going to change anything, and it'll sure make a lot of people happy not to have it.
Karen, what date would you be reissuing this health order from your department?
So it runs out on the 18th, which is a month from November the 18th, so we would go ahead and renew that for another month.
On the December 18th?
Mm-hmm.
Okay, then it'd be up to the commission after that to either accept it or deny it.
Correct.
Okay, understood. Any more questions of Karen this morning? Okay, thank you very much for being here. Thank you for your hard work in this situation. Thank you, Adam. We'll have the disaster declaration issue to discuss next week. Okay, now we're ready for public comment. I think there's some people out there that want to make public comment. I would remind the commissioners that it's been suggested to the chair that public comment is for public comment and not a dialogue with the public, so be it. So
Now, where'd that come from?
that came from the legal department of the county.
And what's the basis for that? Is that an opinion or is that written? I want to see that in writing.
The person presenting their views on a subject that is not before the commission has 5 minutes, and it's not the intention to use those 5 minutes for a dialogue between a commission or commissioners and the public.
Or to submit questions to the commissioners. That's what the purpose, that was what your intent has been, this board's intent has been for that 5 minutes.
Well, intent doesn't sound like a rule or a law. If I'm inclined to ask a question, I'm going to ask a question.
Well, the chairman controls the meeting, subject to the rules of order, so.
Well, let me see the rule of order saying that I don't have the right to ask a question of a citizen of our county. Let's see you do that, Commissioner Sellers. Let's see it.
Well, the chair does have the right to say
Well-
that you did not speak on that subject.
I think
And-
before, excuse me, Commissioner Sellers, I think before that we've always had an opportunity to ask a question, but not to prolong the whole discussion because of a 5 minute, and we can ask that it be extended just a touch. But I think that if there's something brought up among us, that we should have the opportunity to ask a question of the presenter. That's my feelings, and I don't mean to prolong the whole discussion, but I think that should be a limited amount.
Yeah, I don't think it needs to go on in perpetuity for sure, but to make a grab at controlling questioning of a commissioner wants to ask of a citizen, that's a problem. That's beneath this commission.
Okay, do we have any citizens who want to make a public comment on any issue that is not on the agenda? Public health has been on the agenda. Mr. Wells, do you have something that's not on the agenda to discuss today?
Are you saying the public health board is on the... Okay, I'll go first.
I think you heard the remarks that were outside that we've talked about the public health order, we've talked about the emergency disaster order and so forth.
Okay.
You have remarks that don't apply to those issues?
No, I specifically would like to talk about the health order today.
So be it. Name and address, please.
Yes. Brock Wells, 212 West Avenue B, Hutchinson, Kansas. I'm just going to be read from this. I'd just like to ask that please let health order number 20-04 expire on December 18th, and also that we opt out of the mandate of the masks. We have asked for data and justification that shows the mitigation strategies of government, namely masking, social distancing, mass testing, and quarantine of healthy individuals, that has actually produced the desired results, which is slowing the spread. And I don't want to be construed as minimizing the seriousness of COVID, nor the tragedy of any death, but given the severe economic, educational, and economic consequences of government efforts to mitigate the spread of COVID, it's unconscionable to not examine and set policy in a more humane manner. The buck stops with KDHE. They have not been transparent with info and data that should be freely available to the public and public servants such yourselves. Some examples, KDHE does not know the total number of deaths in Kansas or in Reno County in 2020. The KDHE will not release the cycle threshold data on their PCR tests, which is set at 42 cycles, or approximately 10 times higher than the ideal cycle threshold, which you guys just talked about, which creates a very high increase in false positive that also has a devastating economic consequences due to quarantines. And they also purchased some of their tests from China, just a side note there. Lee Norman has also lied 3 different times about claiming mandated mask counties have a decrease in cases compared to non-mandated mask counties, when the data is clear that the mandates do not slow the spread. Epidemiologists have shown that the spread of the virus can be explained by a mathematical model called Gumpert's function, discovered in 1825. Simply defined, this growth of the virus is slowest at the beginning and the end of its natural life cycle. And epidemiologists further explain, specifically to COVID, that the super spreaders, which are the immunocompromised individuals, spread the virus to the population, and that growth increases faster due to more population getting exposed. Whereas healthier individuals with less severe infections and lower viral loads start to act as a brake on the virus, especially the children. Then the infections start to taper off and slow down again, which it looks like that is where we're at in Kansas and Reno County, as Dr. Steffen pointed out a couple weeks ago. COVID has followed Gumpert's function since its release from China and spread throughout the world, and regardless of public health measures, which is why the Great Barrington Declaration was written and focused protection for specific groups of people. We cannot control this virus. It's going to spread. One of the reasons we ask for transparency is emotional consequences of COVID policies. You guys have been briefed about the mental health status in Reno County with the increase of suicide attempts, suicide ideations, and drug poisoning. Since 2001, in November, Gallup polls have asked Americans to rate their mental and emotional well-being. They then group people in categories based on gender, political parties, marital status, age, income, and religious service attendance. And across the board, mental and emotional well-being has dropped compared to last year and some at the lowest levels since 2001, except for one. As people who have gathered weekly for religious services, they have had an increase in their mental health and emotional well-being. In conclusion, we have explained the high-quality science versus low-quality science on masking and lockdowns. We have presented the Great Barrington Declaration and the focused protection, which takes into account the emotional and economic consequences of policies, not just the physical. We have talked about outpatient treatments and preventive measures that people can take against the virus. And so we are asking that Commission let Health Order number 20-04 expire on December 18th and to remove the county's mask mandate. Trust the businesses and individuals to make their own health decisions when it comes to masking and COVID. Thank you.
Thank you. Right on 5 minutes. Appreciate that. Any comments with the commission? We have another gentleman, I believe, wants to address the commission. Sir, come to the podium. Your name and address,
Michael
please.
Murphy, 35810 West Greenfield Road, Sylvia, Kansas. And I've got some handouts for you here.
Weren't you recently elected to some position?
I think so.
You think so? After your day in Topeka?
Yes, I am representative-elect for 114th District, which is Kingman County, Western Reno County, and southeastern Rice County. I'm going to tell you a story. Imagine, if you will, that a serious crime has been committed, and the sheriff and police department have responded and investigated the crime. They've collected evidence and the interview witnesses. The investigation begins to focus on a suspect. Evidence that corroborates the theory is cataloged, and the rest is set aside. The DA files charges, and eventually a trial date is set. The suspect is poor and cannot afford an attorney, so one is appointed to represent him. The suspect maintains his innocence, but at the trial, evidence points to him and him alone. In the end, the jury finds him guilty. He's sentenced to prison. His wife and children are left to fend for themselves, relying on government aid and their church to help as they can. Years passed, and in time, a project that looks at potential wrongful convictions takes up the case. As they examine evidence, they discover vital information was discounted and not pursued by the police and the prosecution. A new trial is granted. Eventually, the man is freed, and the real criminal is charged, but not before the man's life is turned upside down his family destroyed, and years lost, never to be regained. In a criminal trial, there can be different levels of evidence. Eyewitness, which is typically not very reliable, circumstantial and anecdotal. And then there's high-level scientific, such as fingerprints and DNA and such. What, may you ask, does this have to do with the Reno County Commission? The Commission has been given these levels of evidence regarding the China virus and the response. In the example I gave, it's chosen to pick evidence that points to a certain response and has ignored evidence that points in a different direction. In reality, you've chosen to take anecdotal and circumstantial evidence over high-level DNA level type science. Businesses have been forced to take actions that have zero evidence of efficacy, spending resources with zero evidence it will have any effect on viral transmission. Testing with a test that could be as high as 97% inaccurate, taking people out of the workforce for 14 days for a false positive. People forced to wear masks, be refused service, and there are risks to mask wearing, and many people are suffering those maladies. Elected officials are asked to solve problems, but in reality we can do very little that is productive. Government's job at every level is to protect rights, not hand them out and not restrict them. Schools and hospitals come to us to fix problems, but in reality, they can do much on their own. It takes hubris to think we can alter human nature or actual nature, and any action or inaction always has unintended consequences. The virus cannot be stopped. We'll all be exposed to it. Rather than putting Band-Aids on the problem, by ordering masks and restricting group size, there's evidence that the virus can travel well over 100 feet in the air. Real solutions should be encouraged, such as building personal immunity and medical therapeutics initiated with symptom onset. These would help keep the hospital levels in check. The overall survival rate across all ages is 98.9%. Odds of dying in an auto accident, 1 in 104, roughly the same. I don't see anybody afraid to get in their car. We'd all do well to remember that 255,000 Americans die each year from preventable medical errors. I think in the face of this virus, I think it's going to be a lot higher this year. No one should be intimidated. Doctors should not have to fear giving treatments that they may see as best for their patient, and patients should not fear being an advocate for their health if a doctor is afraid to use specific treatments. I heard Ms. Hammersmith a little earlier say, the virus does what it does. And that's probably a very important thing to remember. The virus is going to do what it does, and no barrier you put up is going to change it. I would suggest, I would request that health orders and mandates be opted out of and let go, let Americans do what they want, let businesses do what's in their best choice. But you guys have made a choice. By choosing not to act, you've acted. I'd like, one last thing. How do you measure success? How do you know when this is over? How do you know what's the end game? How do we know when we're there? On the graphs I have there are strictly, there's a really good website that allows you to pick counties and compare states to, counties within a state to the overall state. I just arbitrarily grabbed Kansas, Oklahoma, Florida, and Texas. And in the top when it's cases, in the bottom when it's deaths. And you can see where we are. And so this is in spite of mandates and orders. And the last thing there, the abstract, this is off of CDC's site. And this is a result of 14 random controlled trials. And their end result was this. I just copied the abstract, and I can get you the website if you want it. I can get you the link. But the bottom line is, as they said, evidence from 14 of these trials does not support a substantial effect of transmission of laboratory-confirmed influenza. We similarly found limited evidence on the effectiveness of improved hygiene and environmental cleaning. In other words, the bottom line is the virus is going to do what the virus does. And there's nothing you can do to stop it. Well, thank you.
Thank you for being here. We have someone else that wants to speak, please.
Hi, my name is Connie Newcomb. I'm a owner of property in Reno County. I live in Inman, Kansas. A few years ago, my husband and I visited Dachau, the concentration camp in Germany. And as I walked out of that place, I wondered, as I looked at the houses, the nice houses that were sitting right outside that camp, in their backyard, for several years, people were exterminated and destroyed in a horrific way, unbelievable to mankind. And I kept thinking, where were the people who were going to speak up before this all happened? Did these people speak up? Because once they were once that was in their backyard, they couldn't call the government and say, "Hey, by the way, terrible things are happening in our backyard." No, the government was the problem. So after World War II, as you all know, which was a horrible war and a terrible extermination of many people, several nations got together and they wrote the Nuremberg Code. The Nuremberg Code says the voluntary consent of the human subject is absolutely essential. This means that the person involved should have the legal capacity to give consent, should be so situated as to be able to exercise free power of choice without the intervention of any element of force, fraud, deceit, duress, overreaching, or other ulterior form of constraint or coercion, and should have sufficient knowledge and comprehension of the elements of the subject matter involved as to enable him to make an understanding and enlightened decision. So now we have another crisis that allows people in power to take more power. Thomas Sowell wrote about this in his book called The Intellectuals and Society. He said, the anointed in society like to identify a crisis. They propose a grand plan to fix the crisis. The grand plan nearly always involves spending more of other people's money and or restricting people's freedoms. Because they are so supremely confident in themselves and their ideas, the anointed don't believe they have to show proof that it even works or anything. They just think that people who don't agree with their grand plan are evil or bad, and they should be absolutely supporting their grand plan. They believe that they are entitled to impose this grand plan on others for their own good, of course. If the grand plan fails to solve the problem, which it usually is the case, or makes it worse, which is often the case, the anointed will never, ever admit that the grand plan was wrong. Instead, they will insist that the grand plan was good, but was undermined by people who are evil or stupid. The grand plan didn't go far enough, which means we need to do the same thing again, only bigger. The anointed are often wrong, but never in doubt. So we are smack in the middle of seeing this exact thing. We have hundreds of thousands of people opposing today's grand plan, peacefully upholding their right to petition for grievances. I have been listening to them for months, and I listened even before the COVID thing to many testimonies on other subjects. But the one thing that these petitioners or these public commenters like myself have in common is that they are not being heard. It is like the elected officials are in a glazed over stupor which controls them, and they cannot or will not actually hear the concerns of the citizens who elected them. And this is true as I have listened to commission meetings in other counties, not just in McPherson and Reno County or locally. I've listened even in other states. The idea of representation of the living seems to have escaped their mentality. It is the living who pay the taxes and will have to pick up the pieces. The few elected who actually do listen and are tuned into facts and science, who believe in upholding the Constitution, are nearly always in the minority. And the petitioning citizens are dumbfounded. What? This makes no sense. Where has common sense gone? We scratch our heads and realize we live in a world of delusion. Never mind the facts. Never mind that in the case of COVID, the death rate is equal to other years, according to Johns Hopkins. Never mind that mental health issues are over the top, people are anxious, suicidal, the economy has fallen apart, that roads and bridges still need attention, that 130 million more people than usual will starve to death this year, families are being destroyed from abuse, lack of employment, masking is causing bacterial and strep infections, schools are interrupted, and the age group that is not affected is forced to bear the burden. Never mind these trifling details. There seems to be an endless supply of money for the one all-consuming issue, which is COVID. The fact that there is a 96% chance or more of living through this supposed pandemic somehow makes it worth destroying the normalcies of life, such as going to work, breathing, shopping, having family reunions, funerals, advocating for the sick and the dying and those in nursing homes and more. We will even teach our kids that people in masks are safe.
Connie, it's 5 minutes.
That's 5 minutes?
That's 5 minutes,
Okay.
from 9:55 to 10
Okay, well,
o'clock.
I'm really concerned also about the vaccine, and you need to know that this vaccine, because they're going to be looking for heart attacks, blood clots, seizures, encephalopathy, and other serious side effects. And who is going to advocate for these people in the nursing homes? Are they going to have informed consent? Are they going to be told exactly that what could happen before they are vaccinated? And also, the Pentagon study shows that there's a 36% more chance of COVID issues once the flu vaccine comes out. So now we're having increased issues. The flu vaccine is coming out, and that's a study from 2020. So I am sorry, I should have rehearsed this. I thought I
Okay.
had more time.
Okay, thank you, Connie.
Well done, thank you.
Okay, it looks like we have another person that'd like to speak to the commission this morning. Please.
Do you start my time now, or can I pass these out? Thank you, gentlemen. I'm so grateful to be here this morning. My name is Danielle Henderson. I own my own practice as a grief and traumatic events release practitioner with certifications in several different effective strategies and
I'm sorry,
techniques.
ma'am, I didn't understand what you said.
Am I going too fast?
Yes.
Okay, I said my name is Danielle Henderson. I have my own practice as a grief and traumatic events release practitioner with certifications in several different techniques and modalities. And I've also been a health and wellness advocate, coach, and researcher for 15 years. We know COVID-19 is real. My family has had it 2 times. My mother is a 77-year-old with 4th stage blood cancer comprising an extremely weak immunity, an extremely enlarged spleen, lung damage from last year, from whooping cough and pneumonia, heart issues, neurological conditions, and so on. In 24 hours, she went from no symptoms to needing to go to the ER. But I told her not to speak to any medical professionals and not to go to the ER because I didn't want to lose her to treatments that sometimes, for example, intubation has a 70 to 90% increase in death. We kept her home. I went to take care of her, and I gave her protocols that I have been researching for the last 5 or 6 months. She fell asleep, and when she woke up, she felt 70% better. Not only did it help my mom complete the process of the virus from Sunday to Sunday, but a few weeks later, she went to her lung doctor, and he said, "Your lungs are perfect." It reversed the lung damage from the year before. So she's better after COVID than she was before. There's no reason why people are dying. They're just not being given the solutions. The cures are being censored, and we know there are many doctors with a 100% cure rate. And my natural protocol has been proven effective with so many people right now. According to the CDC's most recent report, the average combined survival rate for COVID-19 across the demographics of all ages is 98.52%. Gratefully, there are thousands of true scientists and doctors who know and speak the truth. The Great Barrington Declaration, which I'm sure you guys have heard about, is comprised of over 12,873 medical and public health scientists and 338,890 other medical professionals. And they have grave concerns, as do I, of the damaging physical and mental impacts of the prevailing COVID-19 policies. You'll see, I'm not going to read everything that they quote, but I quote them in my speech, which I have printed for you, so that you can see that what we are doing is not working. So I've also listed in my speech that I handed out to you in my comments the websites where you can go and see exactly what they say and what is happening, because you need to do your homework. I don't know where you're getting your information, but you need to get it from people that know what's really going on and have a plan, not just a focus on a problem, but a plan. So do not be impervious to the facts. Lockdowns only delay the inevitable, and they leave wreckage in their wake. Initially, it was to flatten the curve. Viruses don't go away. The regular influenza A, it's never going away. We need to develop immunity, and we need to be developing better strategies. Our world is a global laboratory experiment, and we know for certain by the results, the outcomes, the research graphs, and statistics that it shows what we're doing is not working and what does work. So right now, what we've seen, Peru, Belgium, Spain, and the UK, for example, had hard lockdowns and high death rates. Sweden never locked down. They didn't close businesses. They kept schools open. They didn't mandate masks. Approximately 75% of their deaths in Sweden were inside their atrociously run nursing homes. But factoring that in, they fell far below the 96,000 deaths that were projected onto them to only 4,000. States with the hardest lockdowns and measures suffer the greatest COVID-19 deaths. Deaths of despair, suicide, drug overdose, and alcohol poisoning. Death of cancer patients, failure to thrive from isolation in nursing homes, and countless deaths by non-essential medical conditions left untreated, to name a few. The fear-mongering, hypoxia, hypercapnia, and elevated cortisol levels are causing more deaths and problems than the virus itself. When will people see this? Italy has done everything Dr. Fauci recommended, and they still lead in deaths in the world laboratory. I wish masks worked. I wish they worked. But if the current mask and isolation policies work, then why the second wave? If masks worked, then why, out of our local prison population of 1,300 inmates as well as employees forced to wear masks continually, do we have 1,347 positive cases coming from the prison? Why, if these mandates work, is everyone in our prison sick? Why? Maybe we should wear hazmat suits. But no, nurses working in COVID wards with hazmat attire are still contracting the virus. Not even hazmat is going to protect them.
Okay.
Do you see that? My grandmother's in a nursing home, forced lockdown. She's in an old person's prison, essentially. And you know what? They have a 100% positive rate right now. Masks that the general population wears have micron holes 20.25, the size 0.25. And the virus is 0.5. It's like trying to keep mosquitoes out with a chain link fence.
Ma'am, your 5 minutes is up. If you
Okay.
could conclude, please.
Okay, yes. The reason why healthcare workers are exhausted is because they're suffering from hypoxia, producing irreversible brain damage, hypercapnia, elevated cortisol levels, but so is the cashier at Dollar Tree. I've asked. And the stalkers at the grocery store, and you. A definition of insanity is doing the same thing over and over and expecting different results. Masks and lockdowns used in the COVID-19 laboratory conducted on the world have failed. You either walk in fear or you walk in knowledge. You either lead or you cower. Confidence in fully living the one life we get comes from applied wisdom and focusing on solutions. And there
Ma'am.
are solutions.
Thank you very much.
Thank you.
Well said. The definition of insanity.
Okay, is there anybody else?
No, sir.
Okay. We'll go on to item 6, determine additions or revisions to the agenda. Is there any additions or revisions that the commission would like to suggest to the agenda?
Chairman,
Yes.
I started on this yesterday and visiting with Randy and Karen and Joe. And I would like to add an item in business item C, as item C, for the county to consider changes to health order for Reno County to opt out of governor's mask mandate for possible adoption on consideration for adoption on 12/22, our next meeting. And
Is that Executive Order 2068 you're talking about?
no, I'm talking about our county health order.
2004.
Yeah, 2004, changes to that health order. And the reason why is because of the complexity that we've been discussing regarding the one you're talking about, Commissioner, and that is the Governor's Order 68. And so I've spent a lot of time studying and on the whole thing, and that's why I would like to see a potential workup to a change to Health Order 20-04 and to opt out of the governor's mask mandate.
2068.
Yeah. And 2052, whatever it applies to. It's so confusing right now between 2052 and all the rest of them that,
Yeah, I'm asking.
Okay, is there any,
Anyway.
is there any objections to adding item business 8C? Not, so be it, it's on the agenda. Is there any other additions or corrections to the agenda?
Yeah, I would like to go for 8D, and we've had a nice discussion today. And it's time to opt out of Health Order 2004. I want that to be business item D, 8D, and I want us to opt out of Executive Order number 2068, whichever the Kelly administration's most recent, or any of them. 2068, the original, whatever the case may be. And I need the help of a neutral county councilor to sort through those numbers. Do we got one?
Well, but aren't you really talking about the same thing that
No,
Commissioner Hurst?
no, I'm not, because he's talking about making changes to Health Order 2004.
and opting out of the mask mandate.
It's time to opt out of both.
Well, obviously, maybe both of you have different opinions on this, so.
And thus we have different agenda items.
Okay. So be it. We've got item D, which is a suggestion that we opt out of 2 items that we currently have. Does the county administrator have any additions?
No.
County counselor?
No.
Okay. The agenda is revised. Moving on to the consent agenda. This is quite long, and I'll try to modify part of it, but I'm sure that the commissioners might have some questions on part of it. We have vouchers from last week of $432,722.65. We have vouchers for 12/18 of $312,390.62. We have CRF vouchers for 12/05 of $754,489.85, and we have CRF vouchers for 12/12 equaling $537,654.62. We have numerous change orders on taxes. We have minutes of September, October, and November to approve. Then we have resolutions G through M relating to, G through L relating to moving funds, and I'll ask the county administrator to speak to exactly what that does in each of those cases. We have a resolution adopting the flood plan that was presented to us at the last meeting. That's resolution 2020-41. And then we have a request from the Planning Commission to reappoint Russ Gertson for a second 3-year term, and that's item N. Is there a motion to approve the consent agenda?
I would move to approve the consent agenda as presented by the staff and commissioner.
Is there a second? I will second that. For a discussion by the commission on any items, Randy, would you please speak to exactly what is happening with resolutions G through L?
You want me to do it here?
Wherever.
Okay, those resolutions, 2020-35, as shown, transfers money from the Health Department operating fund to capital outlay fund, which is kind of like a reserve fund. And that's kind of the other ones, noxious weeds to their noxious weeds capital outlay, Public Works Road and Bridge to special highway. That's the reserve when they need money for projects during the year. That's kind of that reserve if they need to transfer money or pay for supplies out of that fund. The 2020-38 allows for transfer of money from either the general fund and or the multi-capital improvement fund, which is 98, to a capital improvement reserve fund. The same thing, if there are projects, capital projects that were budgeted in the operating year, things are not completed, we can transfer the money into the reserve fund to finish it in the following year. So it kind of is a reserve buildup on projects, pay for things across years instead of just on the budgeted year. The same thing would take place with 2020-39 out of the general fund and special equipment fund into a equipment reserve fund. And then resolution 2020-40 transfers all fire district general funds to the fire district special equipment funds. This is the same thing, reserve. Some of the equipment purchases, vehicle purchases that have been approved in the past couple of months are out of the reserve funds for the fire districts. So that's what those resolutions do. Okay. Questions on those?
Okay, are there other questions from the commissioners on any items A through N?
Have none.
Okay, if not, please, there's a motion and a second, I believe. Please call the roll.
Commissioner Hurst?
Yes.
Commissioner Stefan?
Yes.
Commissioner Sellers?
Yes. Thank you. Moving on to business items. Item A is a rezoning case of 14.75 acres. We have our county planner, Mark Van Notchen, in the audience. Mark, this data was in the packet, so please review it briefly and suggest what the Planning Commission is asking us to do.
Good morning, Commissioners. Mark Von Atchen, County Planner. This is a request by the John C. Oswald Trust to rezone about 14.7 acres of land from residential, to the agricultural district. The purpose of this rezone is really related to the parcel to the east. If you refer to the map that I provided you in your packet, I'll refer to parcel number 25. Parcel 25 is an illegal land division. It's only about 29 acres of land. The minimum parcel size now is 40 in the agricultural district. And so this parcel is not eligible for permits to do anything with. You can still farm it, you can still do those types of activities, but as far as buildings go, you're not eligible to do that. So parcel 30 is what is consideration today, is to rezone that parcel. That parcel will then be added to parcel 25 to create one large parcel that is 40 plus acres of land, and therefore it would be eligible for permits. This parcel of land, if you know, is essentially right across the street from Plum Creek School on East 43rd Avenue. In my report, it discusses the factors. These are similar factors that we consider with conditional use permits. The process is pretty much the same as a conditional use permit. However, there are some different factors in this report when you consider a rezone. Your decision should be based off of those factors that are in the report here. I will not go over all those, but I will certainly answer questions if you have anything in the report on that. Staff recommended approval of this request based on those 10 factors. I would note that your decision today, should you choose to approve it, you cannot add any conditions of approval, unlike a conditional use permit, where you can add certain conditions of approval to make a certain land use work in there. With a rezone, it is really either yes or it is no. You cannot condition any kind of rezone here. I would add that we've seen no comments from the public when I sent notices to the people surrounding this property. Probably just as important here is this area of land is within the City of Hutchinson's area of influence. I sent this packet to the City of Hutchinson for a possible comment. and I received no comments from the City of Hutchinson regarding this rezone. Held a public hearing last month. Planning Commission reviewed this, and Planning Commission recommended approval of the request by a 5-0 vote. So with that, I'd be happy to answer any questions the Commission may have.
By adding this property to the other property that these people own, you have over 40 acres. Does that then allow them to do something in the future that they cannot do now?
Yes, it would allow them to, actually be able to, get a permit for a house or other structures out there. This parcel right now, you may notice, does not have any real public road frontage now. In order to be able to, build a house on this parcel, which is identified as parcel 30 on your map, they would have to seek some type of ingress-egress easement out there from the adjoining property owner to be able to get access to that parcel. It's proven pretty difficult. I think they looked into doing something like that, and they decided that the better route is to rezone this parcel and add it to the existing agricultural land in order to create one large 40-acre parcel. And it's possible sometime in the future, we could see, another petition to rezone all this back to residential for, say, a residential development, since it's right outside the city limits. However, my recommendation would be any type of residential subdivision should be going through the city of Hutchinson anyway, and not being developed to a county standard, but developed to a city standard. So,
Not to prolong this, but would you just review again the difference between the area of influence and what some are using as a zoning district, the city 3-mile area?
An extraterritorial zoning district?
Extraterritorial.
Okay,
yes.
so an extraterritorial zoning district, of which we have 4, the city of Haven, city of Buhler, city of Nickerson, and the city of South Hutchinson have extraterritorial zoning. What that does is the commissioners have essentially relinquished their right to have zoning in that area around the city limits, and so when some type of development occurs in that area of land, they are essentially going through the city process, and they're not coming through the county, even though the property may be outside of that city limit area. And so when you have an extraterritorial, the city has exclusive rights to control development in that area. The county has no rights. With the area of influence that we established with our zoning regulations in 2016, a little bit different here. We still provide cities an opportunity to apply for an area of influence. The big difference with that is the county still retains the control over the development. So what happens in this particular case is I had sent this packet to the city of Hutchinson. They get a chance to review the proposal. They get a chance to comment. We would include any comments in the packet here for your review. You would still come before this board here and make a decision on this. However, the big difference is if the city of Hutchinson, in this particular case, they would object to this type of rezone, what could happen is the city council could pass an ordinance or a resolution saying that they object to this rezone here. If that is actually done, then what happens, according to our regulations, is that this governing body here would have to approve of this rezone by unanimous decision instead of a majority decision. So that's kind of the long answer. The short answer is they act the same. However, the county retains control over the development out there. So even if the city of Hutchinson, they would file a formal objection to this rezone, this governing body could still approve of the rezone or approve of any other type of development, because it applies to conditional use permits as well. You still retain that control to allow that development to go forward if you want.
Thank you.
Yep.
Mr. Chairman?
Yes.
I would move to approve planning case 2020-13, a rezone of approximately 14.75 acres of land from R1 Rural Residential District to AG Agricultural Land District based on the 10 factors approved by the Planning Commission.
Okay, there's a motion for approval of this item. Is there a second?
Second.
Motion and a second. Is there any more discussion by the commission? I see nobody in the audience that wishes to discuss this. Is there any more discussion? Not, please call the roll.
Commissioner Hurst?
Yes.
Commissioner Stebbins?
Yes.
Commissioner Sellers?
Yes.
Thank you, Commissioners.
Okay, our next item is, I believe we're going to have a phone call from Randy, would you like to introduce this item? Bond financial analysis for courthouse bridge and solid waste improvements.
Okay, yes, I'll give a summary. I want to dial in Greg with Raymond James. He would be the person that would place the bonds and can answer detailed questions about the cost associated with the bonds other than just the initial yearly cost. Hi, Greg. This is Randy Partington.
Hi, Randy.
Hi. I have you on speakerphone. We're at the County Commission meeting, and I'm going to give a quick summary or an overview of the bonds and recommendations, and then they may have some questions about the details of the bond cost.
Okay, great. Thank you.
Okay, thanks. Okay, Commissioners, this item is, as mentioned by the Commission Chair, about the bonds. If we were to do 3 bonds for the 3 large projects, the courthouse improvements, the bridges on 43rd and Nickerson Road that have temp notes right now, and then the landfill, which we are supposed to get the bids the end of this year, early 2021. So those are not final costs yet. But the courthouse is a $3.5 million project with $1.1 million being covered by insurance costs from the earthquake. The bridges are $6.7 million and some change. These are just round numbers. And then the landfill, $4.3 million plus a possible additional $500,000. Still have not made the decision on the fiber connection. That's still in the air. We can make that decision in January, later on when we do the bonds. The time frame of the bonds would be discussion today, get direction of where the term limits and what the county commission wants to put in place, and then updated financial analysis would take place later this week. We would get a request for bond rating from Moody's, distribute initial draft of preliminary official statement, and end of December, early January, distribute draft of legal documents for the bonds. January 5th commission meeting would be to adopt authorizing resolution for the bonds. There's still some work, and then February 2nd would be at the county commission meeting for an adoption of resolution for the bonds. The closing of the bonds would be at the end of February with this time frame. The financing analysis that Craig with Raymond James had put together shows repayment terms different for the landfill, bridges, and courthouse improvements. The landfill would be either 10 or 15 years. The bridges could be 10 or 15 years. And then the courthouse improvements would be 3 or 5 years. The way the courthouse improvements for payment, it's kind of a wraparound bond. So the Public Building Commission has bonds right now, and 2021 is the last year of the $400,000+ payment for that bond. So this bond would wrap around to where the large cost would take place in 2022, so that we could budget without seeing a huge impact. It kind of works that way, and I think Greg could probably answer more questions about how that part works. And my recommendation would be with the landfill and bridges both be 15 years and the courthouse 5 years to maximize the use of low interest rates as we put the budget together. And so for kind of a summary for the courthouse projects, for most of the 5 years, it would be $585,000 a year. It varies a little bit over year to year. The landfill project, which is paid for with landfill fees and not property taxes, is about $375,000 a year for 15 years. And when Megan had talked with you guys at a work session about a financial analysis, this was part of that. They had assumed there was a 15-year payment of about $375,000. So they took this into consideration when you looked at those financing models last month. And then the bridge project, to pay that back, it looks like it's going to be a little over around $600,000 a year for the next 15 years. This would be out of the bond and interest fund. This would be an adjustment in our budget that we would have to find money for. It's not budgeted now, so it would be an increase. We would have to look at what other areas to cut so that the mill levy and property taxes are held to a minimum. And
But we have a annual bridge fund. Can it pay for part of this?
it would take away from other bridge projects. Yes, it's, I think, about 1.2 million is the property taxes it collects every year. So that would take away a lot of other bridge work. If you depended just on that, that would cut that in half.
Do we have a special bridge project fund and also between the bridge fund? Or were you looking at both of those?
Yeah, I was looking, there's different funds, bridge, road, special, special highway, special bridge that put together, but this would be out of the bond and interest. I guess it could come up during budget time. We could look at if you wanted to use the bridge fund. That levies about 1.2 million a year. But again, that would take away from other bridge projects.
And we have a lot of bridge projects that we need to do.
Yes.
And on top of that, we never know what the state's going to come down and inspect a bridge that we didn't plan on.
Right. I think Don does a good job of analyzing all the bridges and has a plan, but there always can be an unknown, I guess. And I think he's well prepared for bridge projects over the next however many years.
Had one come up a couple years ago.
Yes.
He's
So
prepared for,
go ahead.
He's prepared for the bridges he has in his plan. These bridges are not in that plan.
These bridges, I think, were, and the commission, the other two commissioners may know more about the history than I do, but these bridges had been in the discussions previous year, especially 43rd Avenue
This
for
is
years.
43rd and
Nickerson River, South Nickerson Road, over the Ark River.
And the 43rd Avenue is the one over the railroad.
That's over the
Bridge,
railroad.
Northeast part of, or northeast of the city of Hutch.
For your information, Commissioner Stephan, the railroad caused us a lot of extra money. I think it virtually doubled the time they got done telling us what we had to do. But that road, that bridge is vital to the school district out there. Just for a little background.
What'd they do to us? Just building requirements?
Building requirements, Commissioner Seller, you can add to this, but they made us go longer and higher. They say there's going to be
They
2 or
expanded.
3 tracks
Yeah.
rather than just the one that's through there now. So we had to build with their expectations, and then we had to put in some extra abutments.
Yes.
And then because they make us raise the height of that bridge, then the slope down off of it to the old 61 highway, that created additional cost to work that road up to meet the specs. Am I pretty well correct on that, Commissioner Sellers?
Well, and in addition, most bridges like that are the slopes going down to the tracks would probably just be rock and so forth. The railroads demanded that all be concrete sides, and so so I understand that federal and state laws give railroads the right to do whatever they want to in that area above them.
Our rights
Require
are
it.
very limited dealing
Yeah.
with the railroads.
And there's no opportunity to just turn that into a, get rid of the bridge and have a crossing.
The railroad crossing is subsurface. Have you been on that road?
I've been over it a million times. I don't remember it exactly, but.
And the railroad has right-of-ways for 3 tracks. They use one of them, and they may never use more than one of them. But if you put the bridge in, with the bridge we have to go in to cover one right-of-way, and they come along and they want to use the rest of their right-of-way, then this bridge comes out, and you've got to accommodate that, and even 3. So the bridge had to be built higher because it's longer, and that was the result of that.
Randy, are you suggesting that we have 3 bonds here, or why wouldn't we tie the bridge and the landfill into one bond?
It is one bond.
Okay.
There's 3 different payments. I think it's separated to where 3 sources of funding
Okay,
and
but
3 different
we would be
timelines.
creating just 2 bonds here, one 5-year bond
It'd
for the
be
courthouse.
One bond. And Greg, is that correct? It'd just be one bond that would cover all 3 projects?
That's correct. And since these would all be general obligation bonds, we can combine them into one bond issue where we're selling them to investors. And by selling it as one bond issue instead of 3 different series or even 2 different series, that'll save some of the cost of issuance. But then internally at the county, we know that you're going to want to break out the portion of the bond issue payable for the courthouse project, the landfill, and the bridge projects separately. So we set it up with 3 different purposes inside of one combined bond issue. That way we minimize the cost when we're selling it, but then internally you can still see the exact payment schedule for each project of the overall bond issue.
Okay. So what do you need from us today, Randy?
I would need consent to go forward with, if it's these options on the terms of the bonds, if you're okay with that.
Mm-hmm. What do the commissioners think about the longer terms with low interest rates?
I think they've done a lot of research on what's best for the county, and I would go along with the 15, 15, and 5-year repayment plan.
Okay. Mark?
No thoughts.
Okay.
The other option, Commissioner, it would take a lot of our cash balance, but the courthouse project probably could be pulled out and we pay cash and use up, but it would use up a lot of our cash reserve of the general fund. And part of that reserve fund, as we transfer toward the end of the year CIP into a reserve, we may have some money to pay that off quicker in-house. We could kind of borrow from various funds. It's a different way if we didn't want to bond it. It's put in here as a recommendation because the interest rates are very low right now, or they have been for the past year. So it maximizes the
Could you have
financing.
Greg maybe talk about what his expectations are for rates?
Be happy to answer that question. And when you look at start with kind of the bond market as a whole, and then speak specifically regarding the estimated rates for your bond issue. But no surprise to everyone, we're in a very low interest rate environment. But what is a little bit surprising is that the municipal bond tax exempt rates, we set an all-time record low in August. But then from August going up to the election in November, we watched interest rates go up about 0.5%, and a little bit concerned that might be a trend. But the nice part about that is after the election, interest rates reversed course and we're back down. They've come back down about 0.4% or 40 basis points. So we're right now within 0.08% of the all-time record low. So obviously a very favorable time for borrowing. And so when you look at the average interest rate that we're showing for the combined issue, all three components, it ends up being an average rate of about 1.76%. And then when you look at the courthouse project, the average borrowing cost for those improvements, since that's the shorter 5-year scenario, that component of the bond issue has an average rate of about 0.90%. And then the other two components, landfill and bridges that are financed over a 15-year period, those have an average rate of about 1.82%. And then again, the combination of all of those three projects has an average interest rate of about 1.76%.
I don't want to dip into our reserve funds very much. We don't know what's going to happen, and with the state looking possibly not changing any of the tax structure that we have, I'd like to, much as I'd like paid off earlier, I think that interest rate is conducive to allowing us to do the 15.
I guess I'd say on the flip side of that, the opportunity to work around some budgets some and pay off the courthouse window project outside of the bond keeps us from having to borrow as much money, which borrowing money in uncertain times is particularly risky. So I kind of like the idea of working through some of the other budgets and trying to keep the window project out of the deal. I like that idea. I think that invariably would help squeeze us down and keep us a little financially leaner than if we take that pressure off by just borrowing more. Because you never borrow it for free.
Randy, speak to us a little bit more about if we move towards what Commissioner Stephan did. Where do you come up with $2.4 million? And let me make sure I'm speaking the right number. You said it's 3.5 million total with 1.1 in insurance.
Right.
So you've got 2.4 million to pay for.
Right. They're in the general fund, courthouse general fund. There's money for courthouse improvements, and then there's some of the cash balance. There's probably close to $7 million in there that we can move over. That's where it takes away from the cash balance for the general fund. So when the 2022 budget is put together, it's less cash. That would then affect the mill levy. And it also depends on our revenues coming in through this year. So we don't know how that looks right now, but we have the cash. That's where we would do that. Next year in the 2022 budget, there's another $1 million in courthouse improvements. We could also delay some other maybe capital, and I don't have the details, and use that $1 million. Use close to $1 million this year, close to $1 million next year, and then the rest, the general fund cash balance. We wouldn't know the mill levy impact until we get the audit done and everything middle of next year.
But your expertise on budgets is so much greater than mine. I think I heard you say that if we use this cash, it ends up creating a need for a larger mill levy in next year's budget.
Well, we don't know. It would in general, because if we use the cash, that's less cash. So it would, I don't know, to increase the mill levy versus it would change the dynamics of how we budget for 2022 with other departments that are paid out of the general fund. It may just be lower or less capital in other areas to kind of balance it versus really saying it's a millivy increase. Because we don't know on the cash balance. It just would be another hit to the cash balance. It could be done. It would take cash that's in the budget for other possible projects and use it for the courthouse project.
Aren't you getting hit anyway as you repay the bond?
Yes. Well, I mean, on the wraparound, or
Well, you're still having to pay the bond back. You're
Right.
talking about paying that much per year.
yes,
So it's more of a accounting issue where you're getting that money out of. It's all still coming out of the same pot.
except for with the wraparound, we already know in the CIP fund exactly where that money's going to come from, and it's not going to have, for the 2022 budget, it'll have a very minimal impact because we're going to have a bond being paid off pretty much after 2021. So this will just take that place. So with the bonding this,
There's no increase, very little increase.
it's about $100,000 a year increase.
Yeah.
A lot easier to find than
So on the
spending
courthouse one, you're
$2.5
not,
million.
so the courthouse one, you're not gonna make a payment until 2022?
It's a small payment.
payment.
It's
Okay.
on
174.
yeah, which we have in the capital improvement fund.
What, your recommendation is to bond these three things, is that correct?
Yes, that's the recommendation, but I wanted to let you know there is that other option if you choose to use the cash. That would be the one option you have on here. The other two projects, they have to be bonded.
Just think what a great situation you'd be in down the road when you're not making that $580,000 payment down the road when you pay for it up front. It served me well through the years.
It's a,
Well, I slightly or somewhat agree with Commissioner Stefan that if we had the cash to do it, we should do it. And I've always been a commissioner, even here in my prior life at the city, of thinking that municipalities and counties have too much cash reserve. But, you know, looking back even this last year when we thought in March that we'd have a significant decrease in revenue, which nicely didn't happen.
so far.
So far. I think I'd rather take the conservative approach and make sure we have the cash available in the future. So I think I would side with Commissioner Hurst, even though it's been very, very difficult in my career in city commission and county commission to understand exactly how much cash is needed. And if you listen to the managers, they're concerned about being able to pay their bills. So I think I would side with that approach on this issue.
If we didn't have that 400,000 coming off,
Might be different.
I would look at it differently, but you apply the rule of 72s to this, and I think it makes sense to do it this way.
Okay, any other questions before I ask for some type of a motion?
Give me a little clarification there. So in government, the conservative thing is to borrow money, and the radical thing is to spend your accumulated cash. Is that my take home message?
No, I think you're missing the message that I
think
have,
so,
that
too.
I've, you know,
Well, help me
unlike
understand.
you, where I think this is your first public office, I was on the community college board for 16 years, city council for 8 years, here now for 2 years, almost 2 years. In each case, management of those entities wanted to have more cash available than I felt like was probably necessary under normal terms. But I also think that you don't want to get yourself into a problem, and this relates somewhat back to what I've talked to you a couple of times about, is the state mandating that we can only raise so much based on a backwards average and so forth, is I think that when people are telling you can only do certain things, you need to protect yourself, and maybe one of those ways is to protect yourself is to keep cash.
I've kind of looked too at some of the same background except for JUCO, but we're looking at some things on down the road with regard to EMT locations and building necessities that we're looking at on, and that may come up in regard to, we may have to look at some of these other movements within the county that require some cash that we could readily use this cash reserve for. So.
Whatever. That's a definition of big government right there.
Well,
I don't
think
how
that
government universally grows and never contracts.
I don't think that's fair. It's fair in your mind, but I don't think it's fair in my mind.
Well, I think we just wrote a textbook on it, but that's okay.
No, because we've got some money coming off the bond. We haven't increased it to speak of any at all.
The other thing is
we haven't decreased it, but
with the bridges, we're also going to, with the budget, have to find how to pay for that.
Yep.
Because that will impact all budgets, because it's general obligation, as Greg mentioned, so it's all backed by property taxes at the end. So,
yeah, I think that.
So it will, keeping some cash will help on that side. It may.
That $600,000
may still
payment
go away, just in a different line item.
The $600,000 payment on the bridges is going to be a hard one to see in the budget for next year.
That one will be, yes.
It goes back to services required and infrastructure required.
Okay. Any more questions? Is there a motion? I would make the motion that we advise the county manager to proceed to bond the courthouse improvements on a 5-year basis and the bridge and the landfill-based improvements on a 15-year basis, understanding that bridge and courthouse is general taxes and the landfill would be paid for by user fees.
That's correct language. Not to offend you, but just making sure. I would second that.
Any further discussion? Please call the roll.
Commissioner Hurst?
Yes.
Commissioner Stefan?
No.
Commissioner Sellers?
Yes. Motion passed. So when will we hear from you next time on these bonds, Randy?
I believe, let me look at the calendar, I'll keep you updated during that time, but I think the next time the commission has to do anything is January 5th.
Okay.
Thank you, Greg.
You're welcome. Thank you. Have a good day.
Okay, would the commission like to take a break or move right ahead? I'm open.
Your call.
It's up to your call. Okay, let's move right ahead to items C and D. And so at this time, since C was requested by Commissioner Hurst, would you please explain your business item here and where you're wanting us to head with that, please?
Okay. I would like to, after missing a lot of sleep and a lot of study and a lot of thoughts, I would like to opt out of the governor's mask mandate. not political. I guarantee you, it's not politically motivated, and it's not based on any report such as Barrington. I in essence would follow the governor's mask, taking out that and changing one sentence in the 2020-04, and this would be a suggestion with regard to how we can comply with the legalness of it after visiting with our county counselor, and replacing basically in the guidance for business.
I'm sorry.
Which
where are you looking at now?
the 2020-04.
2004. Okay.
Yeah.
Where at in it?
It's in the guidance for business. It's in the last page there, guidance for business.
Okay.
And this is preliminary depending upon how we can proceed with it, okay? But to change that to delete that one sentence, follow the governor's mask order, and replace it with respect and abide by the decisions of all businesses that require the wearing of masks while in their businesses. I think we have a health order and a health officer that is doing their best with regard to keeping our businesses open and to follow the guidance of not only that but our local. And that's that may change a little bit, but I'd like to work on this
Okay, so
health order.
Am I understanding you that this is the health order that Karen suggested that she would like to have, she is intending to execute on the 18th of this month?
Yeah, it would be.
What I'm hearing you say is you would like to work with her to have some wording changes within that health order.
Yes. Mm-hmm.
Okay?
And take out the reference to require. In talking with county counselor, there's some things in that 68 order that we need to work with, and so it's far from finished with regard to that. I think a health order is fine with me. I think the people are asking for some guidance. Businesses have been asking for guidance, and I respect that for coming from our health officer with regard to that. And I've got more comments to make when we're later on. I don't think they're necessary right now with regarding to patrons and citizens with the fact that if a business or individual, if a business wants to say, I want masks, that's their right. And we should abide by that. And it's not if a business, it's not infringing on your rights at all. But that's where I'm at. I thought that the health order was as a whole fairly well written. It's just that's what I'd like to have the option to work on and be presented back to on 12/22. Okay.
Well, I see no reason that you can't, as an individual commissioner, do that process and bring it to us for our agreement or disagreement.
I would suggest that you seek input from other commissioners as you do it.
I can't very well do that in a non-open meeting.
Yeah, that's a good point.
Yeah.
You can work on it and send it
I can
through,
work on it with Randy
and then
and
go back
Joe
around.
and Karen.
And
Yes.
then you can send it back around.
Yeah.
I would strongly encourage that you do that.
But well, that's what I'd like to have. I'd like to have the
No,
opportunity to do that.
see
And I'm
no-
basically presenting it to you for consideration in this, so that we kind of know what I'm thinking of here. Okay.
Understand. I appreciate you alerting us to that.
And you still want to leave the 10 people deal in there.
there is not 10 necessarily. If you read it a little further, I don't have it, I can go out and get it here in a minute, but.
Now, Commissioner, just a reminder, this health order by the health officer, she would put this in place this week.
Yeah.
Because it expires. So.
And it won't be, 2004 goes away.
It'd be
There's another one.
2005.
There'll be another one come out.
So-
Okay, I didn't realize that they rechanged the number.
Yeah.
But my idea would be to retake this up, whatever the health order is, between the 18th and our
See,
next meeting.
Well, and I think Commissioner Hurst makes a lot of sense, because to draft these things in a meeting is very difficult to do, even poorly. And if he's got someplace that he wants to move with this, I think he should make that known to us ahead of the meeting, so that we aren't trying to digest something that's reasonably complicated.
We're social distancing.
Yeah. And then, yeah, and
We're
you're
social-
100% right. We could be here for a week. hashing
And
this
you're
out
gonna
in a
ask for a
meeting.
comment, and he's gonna let.
Right, right.
You
And
know,
we,
and-
yeah, I don't want to perpetrate that.
It's not good to try to do it in a meeting. His ideas need to be known by the other commissioners before the meeting. And I'm very willing to listen to your ideas, Mr. Hurst.
That's where social distancing isn't able to apply.
Yeah, it's,
I know, I struggled with that too when it was originally brought out.
well, and again, you need this, the loop needs to include me in this, so we don't have to have a big, difficult discussion in a week.
Yeah, and that was the purpose of bringing this up.
Appreciate it.
There might be a couple other things I might look at too on there, but
Okay,
I think it
Is
probably,
that enough
consensus is good
information for
enough.
your item? Okay.
Is consensus good enough, Joe, to proceed with something like this?
Well, I don't think we have consensus on anything. We're asking him to put a document together
All right.
and send
I
to
agree
us.
with that. We have consensus on that.
Okay.
Back in the summer, you adopted an order establishing less restrictive conditions than the Governor's Order 2052, which you're authorized to do by House Bill
2016 something.
2016. So I think with respect to the Governor's Order 2068, you're asking for, and we could draft a local order imposing less restrictive conditions than the governor imposed by that order, that being, she required the wearing of masks, and just like you did in the previous order, you could say that the wearing of masks is not mandatory in Reno County. I think that's what you were asking to be done. And so I would address that subject in one order, and I would address your right to override the local health officer's order in a separate order rather than mixing the two together, and that's a format issue. So with respect to the local health officer's order, at this point, we haven't seen what 2005 is. So if, and that will come out within 3 days, I guess by Thursday, if she wants it to be effective before the other one expires. So I'm wondering whether you might see between now and then whether you and she can reach consensus on what it is you're asking. Because if she comes out with an order which is consistent with what you want, Commissioner Hurst, then at least your concerns are addressed. If that can't be done, then if that order is out, we need to look at it and decide what portions of that order you wish to override, which is also your statutory authority to do.
Can we line item rescind?
It can be whatever portion of that you want, right? You could.
Takes
render
2
it.
votes. That's 3 of us, and it takes 2 of us to agree on something. So, it's,
You can change it. What I'm hearing you say, if I think I'm asking your question right, is if there's wording in there that we want changed, override or change, that we have the authority to do that.
In effect, yes.
Okay. Providing we have this other order.
okay?
Like I said, I've been trying to relay this. It's not as simple as what it sounds like it
The whole
should be.
thing. Okay, does, item D, does that still need to be discussed, or has that been taken care of?
We can withdraw it for now. I'd like to see how this plays
Okay,
out.
okay, thank you.
Thank you.
Other commission comments, first on here is Commissioner Hurst.
Yes, last Thursday, this is kind of bringing you up to date on something, and because I'm one of the representatives, along with Jackson Swear, to South Central Kansas Economic Development District, which is a group of 12 counties. Just to report a little bit on some loans. In November, the SCED provided loans to entrepreneurs in Wichita and as far away as Manhattan, Kansas. In comparing 2019 and 2020 loans, and 24 loans were dispersed in 2019 calendar year at about almost $3.6 million. And in 2020 to date, 26 loans with over almost $8.6 million. And so had 140% growth plus from the calendar year. And economic impact metrics with regard to these loans, 63 jobs created, 46 full-time jobs were created in the next 2 years. And of those businesses that were loaned money, 25% were minority-owned, 20% are women-owned, and 70% of those are startups. And the process through this whole is really had quite a nice turnaround and change for SCED. And we have several. They've partnered with our Reno County Network Kansas program, as Daniel knows, as well as our own one of USDA grant program and the funds we circulated. So a lot of it's gap financing that we use here. So just kind of getting you up to date on that.
Well, Ron, isn't it true that it appears that SCED is becoming more active? Our local SCED group is being more active than they have been in the past in general. Which to me is a real positive thing. It just sometimes seems like in the past they were there, but did we make anything happen? And it seems like now each year they're doing more.
Yes, and that's all due to new
management
and a team approach to the whole thing. And their marketing program is expanded. Their computer program has made new computer programs, and the loaning part of it is a lot quicker now than it's ever been. So it's all factors.
It would appear that it's more beneficial to the state than it's been in the past. More comments, Ron?
Just the fact, Commissioner Stephan may not know that each county pays some money into SCED for to be a member of this to allow us to do things.
Okay, Commissioner Stephan, your comments today, please.
Well, first off, in the spirit of the holiday season, Bright House, Open Door, and Prairie Star have all received my first two paychecks. They've each received about $450 apiece, and will continue to receive the money. And I encourage everybody to pick your favorite nonprofit organization and donate in the spirit of Christmas and giving and servant leadership. We've heard some good citizen reports today. This virus is a mess. There's no question about it. A lot of the mess comes out of politics. And we've got to start having a vision for an exit ramp, for an end game on this. This cannot control us forever. And we can't just put blinders on and plow ahead and proving Einstein's definition of insanity. We can do better than that. We understand this virus to a large degree. We all have good God-given common sense if we so choose to practice it. And we need to move towards an open economy. We need the schools open. The State Board of Education voted 10-0 this week that the kids need to be in school. And then I think yesterday the Hutchinson School District went totally remote. So we've got an incredible disconnect between what we're learning scientifically and from the data and what's being practiced. And that's where I keep talking about this fear campaign. That keeps us disassociated from reality. We've got to have an off-ramp. We've got to have a successful economy. We've got to support our small businesses, particularly through the end of the year, because they're on the brink. So I appreciate it.
Okay, thank you. Under my comments, I gave you last week a synopsis of a December 4th call that I listened to with Governor Kelly. I think one thing that I really agree with Commissioner Stephan on, and we've written a letter to the state, and I know Sedgwick County has also, but nobody seems to be listening. I just don't understand why teachers aren't really high in this pecking order of vaccines. And I agree that schools should be in session, and my understanding is part of the problem is not the infection of the students, but it's the infection of the teacher and the staff being able to be there. And if we vaccinate them, it would seem like to me that we would be helping get those schools all open. I must be missing something, because that's not seemed to be coming down from federal or state people that way. I see no problem extending our disaster order like Adam is requesting next week. That just makes his job so much easier, and if we can get things from the state and federal people that we can't get except by using our own money, to me it just makes fairly common sense to do that. I think that's all I have today. I believe, Mr. Hurst, you have a motion to go into executive session, please.
I think I finally found it. I move we recess into executive session for a period of 20 minutes for the purpose of conferring with legal counsel on a privileged legal matter pertaining to further discussions of a contract to provide partial funding to New Beginnings, Inc. for a proposed inpatient detox facility. No formal decision will be made. At the conclusion of the executive session, the board will return to regular session and then adjourn for the day. I ask that the county councilor and county administrator remain for the executive session, and I'd like to have about a 5-minute recess in between.
Okay, so that session will start at...
or 3 minutes, whatever the committee chairman would like.
Well, let's start that meeting at 11:18.
Okay.
On the official clock.
On the official
The
clock?
official clock on the wall. Whether that's fast or slow, it's still the official clock. Okay, there's a motion. I will second that motion. Is there discussion? If not, let's please call the roll.
Yes.
Thank you. Commissioner Hurst.
Yes.
Commissioner Stephan. Commissioner
Yes.
Sellers.
Yes.